Conversation Training Therapy by Lauren, Tristan, and Addie.
Conversation Training Therapy, otherwise known as CTT, was developed by Jackie Gardner-Schmidt and Amanda Gillespie in collaboration with 5 additional SLPs who specialize in voice treatment. So their article, The Development of Conversation Training Therapy, a concept paper, got published in 2015. So they worked to identify the problems of a more traditional hierarchical voice therapy approach, such as length of time in treatment and the ability to achieve balanced phonation at conversational level. So they then wanted to create a program that aimed at getting rid of that traditional therapeutic hierarchy. So CTT uses patient-driven conversational narrative that focuses on voice awareness and production in conversational speech. So this program is grounded in motor learning theory, focusing on training target voice goals in spontaneous conversational speech. So throughout therapy, patients may be able to achieve balanced phonation and an increased awareness of their voice in conversation.
This is a quote that we found from Gardner-Schmidt and Gillespie that summarizes the goal of conversation training therapy. It says the goal of CTT is to achieve generalization of the target voice technique in everyday conversational voice as quickly as possible.
The first component of conversation training therapy is clear speech, and here you just want to encourage the patients to use clear speech from the start. In 2023, Miwa and Chung said you need to model how to exaggerate articulation, pause between phrases, and use a slightly louder speaking volume, all while sounding natural and not forced, and you want to cue and model as appropriate. The second component is auditory and kinesthetic awareness of voice production. And here you want to ask the patient to feel their voice in a new way compared to the old way. And you want the patient to label voices in a way that they can remember. For example, a weak voice versus a clear voice. The third component is rapport building. And here you'll engage in a patient-led conversation. Fourth is negative practice and labeling. And here you want to have the patient regularly switch to their old voice in conversation so they can feel the difference between the two. And this helps the patient realize that they are in control of their voice. The fifth component is embedding basic training gestures into speech. And here the patient sustains consonants randomly throughout conversation, and you want to encourage the patient to feel the sustained consonants at the front of their mouth. And the sixth component is varying prosody, projection, and pauses. And this helps improve pitch, timing, and loudness. And with the pitch, it encourages higher phrases. Timing, you want to clearly articulate the sounds of each word. And loudness, you want to slowly project your voice while speaking.
Conversation training therapy is unique compared to other voice therapies because in CTT, the therapeutic hierarchy is disregarded. So when practicing this therapy, it may look a little different. CTT is done using the 6 components that were discussed earlier at the conversation level, and in CTT you begin with clear speech and you mirror the target voice.
Here we have included a scenario that might help someone to better understand CTT, so please feel free to pause this video and read on your own.
Conversation training therapy is typically prescribed to patients with muscle tension dysphonia. Here's a picture of it on the left. And also patients who have benign vocal fold lesions. And the picture on the right, you can see the difference between normal vocal folds, nodules, and polyps.
The developers of CTT gave the following guidelines for what voice patients are a good fit for their program. So the first is that the patient is able to speak at a conversational level. So for example, someone who might have mild to no aphasia, or someone who has enough breath support to produce sentences. The second is that the patient is stimulable for clear speech. The third is a patient who has good cognition and a cognition that is intact. The fourth is that the patient can hear the difference in their voice, both with and without clear speech. And then the fifth is that they can feel the difference in their voice with and without clear speech.
This was a study done by Gillespie and others in 2019 involving participants diagnosed with benign vocal fold lesions or primary muscle tension dysphonia, also known as MTD. The focus of this study was to compare participants with benign vocal fold lesions, or MTD, to historical matched control patients. The participants with vocal fold lesions and MTD were treated with conversation training therapy. Prior to therapy, they completed the VHI-10 and underwent instrumental acoustic and aerodynamic testing in a sound-treated voice lab. For the acoustic analysis, patients were sitting upright and instructed to read 6 sentences from the CAPE V protocol. The aerodynamic assessment was completed using the Pentax. The participants were randomly assigned to an SLP trained in CTT and attended 4 sessions for 45 minutes each. The outcomes were collected at the start of each therapy session, 1 week post-therapy follow-up, and 3 months post-therapy follow-up. The patients that these participants were matched to were selected from a database of patients treated with standard of care voice therapy at the same tertiary care urban academic voice center. Those who underwent voice therapy between 2010 and 2012 and met the same inclusion and exclusion criteria as the CTT cohort were included in the pool of potential HMCs. They used a 1-to-1 ratio matching patients on baseline variables including age, gender, and diagnosis. One of the outcomes in this study was that the participants with CTT showed greater improvement in perceived voice handicap than those treated with standard of care therapy. More specifically, participants in the CTT cohort achieved equivalent gains in terms of the mean VHI-10 decrease following only 2 sessions of CTT compared to those observed at therapy completion with standard of care therapy. The researchers also found that participants demonstrated a significant decrease in vocal intensity when participating in CTT. CTT also improved acoustic and aerodynamic and auditory perceptual voice outcomes, both immediately following treatment and at long-term follow-up. This information allows us to further understand to whom this treatment can be applied. With further research, conversation training therapy can be a very effective strategy for us to use in our practice when working with voice disorders.
Another article we used for our research was Assessing Candidacy for Conversation Training Therapy, the Role of Patient Perception. And in this article, there were 50 patients with muscle tone dysphonia and benign vocal fold lesions who read a passage in their comfortable voice, and then they completed 4 weeks of CTT training where VHI-10 scores were collected throughout the intervention. And this study demonstrated positive change among patients and how their voice felt and sounded. With CTT, patients immediately change their voice in the first session, and then they continue throughout all of therapy. So therefore, feeling and hearing a difference in their connected speech leads to success throughout the treatment. And this is relevant because it shows that voice production feedback can be used to both improve voice and maintain this improvement, which then leads to greater and faster voice improvement while receiving CTT.
Hi, Miss Addie. How are you doing today?
Good, how are you?
Oh, I'm good. Thanks for asking. So today during our session, we're going to do a little something different. So we're going to think about speech in a more natural setting, especially in conversation. So as we speak, the first thing that we want to think about is having a good posture. So just sitting up nice and straight. And then we're going to try to think about our voice being slow and a little bit louder to try to achieve that clear voice. So do a little something different. So in conversation, let's go ahead and talk about what you did this past weekend.
I went to a wedding. My cousin got married on Saturday, and we went to the rehearsal dinner on Friday.
That sounded great. I like how you did slow and clear. So now we're going to think back to our old voice, and go ahead and tell me how you feel like your old voice sounded like, and we can give that a name.
My old voice was kind of raspy and strained.
Mm-hmm. And then what do we think about our new voice now?
It's much clearer and easier to understand.
Absolutely. So we're going to use our old voice right now to try to think about how it feels. And we're going to talk about what we're doing this upcoming weekend in your old voice.
This weekend, my sister is coming home from college, so we will have family dinner, and my niece has a softball game that we will go to.
Okay, so now we're going to do that exact same thing again, and we're going to try to do that slow, clear voice that our new voice sounds like.
This weekend, my sister is coming home from college, and we will have family dinner and go to my niece's softball game.
Great!
These are our references that we use throughout the presentation. Thanks for watching.